of the disease, but a standard screening test can stop it in its tracks. News 13's Jessica Foster tells us more about the importance of regular screenings in tonight's Modern Medicine Report.
March is Colorectal Cancer Awareness Month, and it's time to talk about a test that many people dread, the colonoscopy. Doctors say it's actually a simple test that could save your life, and starting at 50 years old, all of us should have it done.
Well, they found some polyps and things, 6 or 7 polyps that they needed to remove at the time, and then they found a large one that they sent in, and it came back as cancer.
56-year-old Michael Donaldson's cancer was found during a routine colonoscopy. He had no symptoms.
Polyps or early cancers will not typically cause any symptoms in patients, so the only way to know is to have it checked out.
Gastroenterologist Dr. Christopher Wells says a colonoscopy is the way to get it checked out.
The purpose is to inspect the lining of the colon to look for any types of growths. In the cases of polyps or small growths, those can be removed during the procedure. The goal there is to prevent cancer from ever forming, and the majority of colon cancers are preventable by removing polyps.
Michael delayed having his colonoscopy for a few years after turning 50. He says if he'd had it earlier, he might not have had to go through surgery to remove 7 or 8 inches of his colon.
Don't put it off. I've told all my friends at work and everything like that, it's, you know, you're turning 50 now, let's go get this thing done.
Dr. Wells says in the future he does expect less invasive screening tests, but for now the colonoscopy is the most comprehensive screening tool available. He emphasizes that the worst part is the bowel prep that's done a day prior to the test, but the actual test is not painful and is done under anesthesia.